Thank you for choosing Children's Home Health Care. We understand the care of your child is your primary focus, and this short video is intended to provide an overview of our agency. We want to partner together for your child's health care needs. Much of the information shared is also available on our website at www.children'somaha.org/homehealthcare. There you will find links to developmental milestones, immunization and safety information, recall alerts and important product information, and manuals for home medical equipment. If your home is not equipped with internet, please indicate your need for a paper copy. Your parent handbook may be referenced at any time and covers all services offered by Children's Home Health Care, including home infusion, respiratory care, home health nursing, private duty nursing services, home medical supplies, and rehabilitation equipment. Our phone number is located throughout the handbook and on the back cover. Office hours are Monday through Friday, 8 a.m. to 5 p.m. If you need to reach us after hours, on weekends, or holidays, rest assured we have staff on call 24 hours per day, 7 days a week. Please allow up to 30 minutes to return your call. Any emergency situation, always call 911. Always know what to do in case services are interrupted due to weather or natural disasters. We want to know where your family would relocate if services were interrupted. We will ask for you to identify an emergency contact where we may reach you if such an event were to occur and your family relocated to accommodations with power. We are required by law to notify you of your patient rights and responsibilities. It is important to review this information in advance of the care being provided. You may exercise these rights at any time. We also have patient responsibilities, needing information about updated insurance, phone number changes, and address changes, to name a few. In addition, we want you to participate in your child's care decisions. After all, you know your child the best and know how we can best approach his or her care. The charges for your child services are listed on your client equipment rental agreement form as well as on each delivery ticket. Each insurance program provides coverage differently, so we recommend you contact your insurance provider to be fully informed about your coverage. Annual deductibles could mean that you may be responsible for any out-of-pocket costs not covered by insurance. Your client equipment rental agreement also indicates the replacement cost you are responsible for if the children's home health care equipment is not returned when treatment is completed. Please allow us up to 1 week to pick up equipment once it is discontinued. Your insurance will not be billed for any days beyond the physician discontinue date. For billing-related questions, please call during business hours and we will be happy to assist you. Our goal is to provide you with the best possible service, and we want you to have confidence and trust in every provider. You have the right to voice any complaints, concerns, or grievances by calling one of our managers. We want you to speak up if you have any questions or concerns. You may also contact the Medicare Home Health Hotline or the Joint Commission by calling the numbers listed in the handbook. If your child has a life-threatening condition and is age 19 or over, we have information available on advanced directives. Located in the back of the parent handbook is a copy of our Joint Notice of Privacy Practices. We are required by law to provide this notice to you. Please review it and ask your clinician if you have questions. This concludes the introductory portion of your child's admission to Children's Home Health Care. Please let your clinician know of any questions you may have. Thank you again for choosing Children's Home Health Care. We look forward to serving you.
Hi, my name is Grace and I'm a nurse at Children's Home Health Care. I'm going to teach you how to provide phototherapy for your new little one on this video. Now that you have watched our parent handbook video, I will go over how to set up the equipment, how to use it with your baby, and review some of the most important things to remember during this time. A nurse will call you once you've had a chance to watch this video and set up the equipment. She will go into more detail and ask some questions to verify your understanding of this instructional video. Your baby has jaundice, a common disorder of newborns, caused when the bilirubin, a byproduct of the breakdown of red blood cells, is elevated in the baby's blood, resulting in a yellow color to the skin. Used for many years as a safe and effective treatment, phototherapy consists of simply shining blue light onto your baby's skin surface. This light breaks down the excess bilirubin in the skin, which is mostly removed in the stool, and brings the bilirubin back to a lower level. It is important to expose your baby's skin to as much of the blue light as possible. Phototherapy at home allows you to comfortably bond and feed your new baby at home. There is home phototherapy instruction sheet located in your folder that may help answer some questions that come up as we explain how to use our equipment. Your doctor has ordered single bank phototherapy for your baby. This is our BiliSoft. So you will open the equipment bag and you'll see there's a picture here that shows everything that's in the equipment bag and then how to put it back in when therapy is complete. So first, you can take out the LED light panel. Then you'll take out this box, and there is an additional cord. So this cord will connect into the back of the box like this. And then you can put this in any outlet in your home. We do have a 3 to 2 prong adapter located in your equipment bag if your outlets do not match the equipment provided. Also, make sure that you put the box on a firm, smooth surface. This fiber optic cord will magnetize into here, and you'll hear a click. This light panel has a portion that's for treatment, and then a portion on the back that is not for treatment. You will see, if you look closely at your light panel, that there are 6 faded blue circles. If you have a different version of the Billy Soft, you'll have a whiter panel and a picture of a baby. So you'll know that is the treatment side. When you flip over, there'll be printing on the other side, and this side does not emit any blue light. So you'll want to make sure that you put your baby on the treatment side of the panel. Also in your bag is a protective pad for the panel. There's a thicker side to the pad. That's where you want baby to be. So you want to make sure that the thicker pad piece and the light panel where the treatment side is are put on top of each other, and that is where you will put baby. Then you'll see there are 2 ties in the back here so that you can loosely tie a bow around baby if you wish to keep them stable on the equipment. To turn the equipment on, you'll just flip the switch, and that is it. You'll definitely be able to find your baby in the dark. Now that the equipment is all set up, let's get baby ready to go. First, make sure that you have the equipment off before you get baby on the lights. So first you want to undress your baby all the way down to just their diaper. So you are going to place your baby on the light like this, exposing as much of their skin to the pad. Then you can lightly tie a bow if you wish to keep them on there. And then we will need to protect the baby's eyes. Located in your equipment bag, you have an eye mask. This eye mask is required while the baby is on phototherapy to protect their eyes from any harmful effects of the light. This mask is adjustable on both sides with Velcro. So you will place this under baby's head and then adjust the mask as needed to provide a snug fit over baby's eyes. Once the mask is on and baby is situated on the lights, you're ready to go. So you'll turn the on switch on, and phototherapy has started. Now just a couple points about the lights. This does not provide any warmth for your baby. So you will want to pay attention to the temperature of your home and how you're going to keep baby warm while they're on the lights. So there's a couple different ways that you can do that. You are able to use blankets and swaddles to help keep your baby warm and comfortable on the lights. This can be achieved by simply just wrapping your baby in a blanket and holding and feeding them like normal. An alternative to the eye mask that some parents choose to do is to swaddle their baby in a way that their eyes are not exposed to the lights. To do that, a lot of parents find a sleep sack helpful. What you will do is you will place baby and the light into the sleep sack. You will then adjust baby so that the head is off of the lights. You will put baby's arms in the sleep sack, ensuring that the light is below the level of their neck. You can then zip up the sleep sack, and the fiber optic cord can come out the bottom. When you go to swaddle the arms, make sure that you are putting the fabric over their shoulders and down to protect any exposure of the light. You will then swaddle your baby, making sure that there's nothing in between your baby's skin and the light. You will then fold the other part of the swaddle over the other part of their other shoulder. If you are able to swaddle your baby like this and you cannot see any of the blue light, then you can remove the mask. This may help everyone feel a little bit more comfortable. Also, if you do not have a sleep sack like this, you can use a regular blanket to achieve the same effect. Please make sure that the blanket that you choose to swaddle is a little bit thicker and not see-through, because the lights will still go through it, and then that would not be a safe option. So you can remove your baby from the sleep sack, and we will show you with a regular blanket. It is helpful when you're making the beginning of the swaddle to fold down a couple layers at the top to form a thicker protective layer around their neck. You will then place the light and the baby the same way that you did in the sleep sack, ensuring that baby's head is off of the light. You will then fold down and around, making sure that when you loop the swaddle, you are going under the light so that you are not blocking your baby's skin from the light. You will then fold the other shoulder piece over, like so. So as you can see, there is no part of the blue light that is being exposed to baby's eyes. If this is the case, you may also remove the mask. If you do not have a swaddle that will work to protect the baby's eyes from the light, then the baby must wear a mask at all times. We do recommend, if your baby is using the mask, to take the mask off every 4 to 6 hours or as needed to give their eyes a break. If and when you do that, please make sure that you have put some sort of barrier between their eyes and the blanket before you remove the mask to make sure that they cannot see any of the light. Then remove the mask and check and make sure that everything looks okay around their eyes and face. Then, when the break is over, please put the goggles back on and you may remove the blanket. You can then reposition baby so that all of their body, including their head, is on the light. Now, because baby is going to be on this light as much as possible, there's a chance that baby might pee, poop, spit up on the light pad. If that's the case, you can remove this cover and you can wash it off in the sink and dry it out and put it back on the light panel. If it is soiled beyond repair, let the nurse know, and if we are coming out the next day to see your child, we can bring you a new cover. That's it. Your baby is ready to go. We are going to ask that you record a little bit of information during this time so that we can update the doctor on how your baby is doing. In your folder, you will find a sheet called the Parent Daily Homework Sheet. We are going to ask that you record your baby's temperature about 4 times a day and try to space it out if you can, so about every 6 hours or so. And we would like you to take an axillary temperature or underneath the arm. The ideal newborn temperature range is between 97 and 99. We would also like you to record how many minutes you nursed the baby if breastfeeding, or how many milliliters or ounces your baby took if bottle feeding. Please include both pieces of information if you are supplementing. Place a check mark here for a wet diaper and a check mark for a poopy diaper. This column is for the number of minutes that your baby is not on the lights. We strongly recommend that your baby is on the lights continuously. If you need to return to the doctor's office the next day for a follow-up, then you would mark down the length of time you were gone for the appointment so we know how much time your baby spent off the lights. I would like to reinforce a few key things before we're done. On the front of that homework sheet, you will see a yellow sheet that highlights the very important information to remember. Be sure that baby is fed at least every 2 to 3 hours. This is going to help decrease the bilirubin in combination with phototherapy. Follow any additional feeding recommendations provided by your baby's doctor. Be sure the light pad is on continuously and use the eye mask as directed. A sleep sack or a swaddle blanket is helpful to keep the light pad in place and keep the baby comfortable. Check your baby's temperature every 6 hours and ensure that it is between 97 and 99. Please fill out the homework sheet as indicated. There is also a phototherapy teaching checklist located in your folder. This reviews in detail the things that we covered in this video. Your nurse will review more information with you over the phone and help answer any questions you may have. Remember, we have a nurse on call 24/7. Thank you so much for your time. Congratulations on your new little one, and we'll be checking in with you very soon.